guys, welcome to my channel. This is the first video I'm going to be making with regards to my life as a pharmacist and how I changed from pharmacy into medicine. Basically, in this video we're going to discuss my transition from pharmacy school and my life as a pharmacist, and how I decided to change into becoming a medical student and soon to be a junior doctor. So at the time of this video I'm currently in my final year of medicine, and I'm going to be starting my medical FY1 in Malta, approximately starting in October. At this time I feel that I'm rather anxious and excited at the same time. You know, it's a new experience going from pharmacy to medicine, and what I feel about the transition is that I gained experience being a pharmacist, and I think it's going to help me greatly in my career as a doctor. However, I also dread the fact that I have another 2 years to go until I am qualified again with a medical license and able to practice medicine independently or continue studying at a more specialized type of specialty. For example, the thing I'm aiming for is probably GP, okay, or general practice. Family medicine. The reason for this is that I think it gives you more flexibility compared to other specialties, and it has also a shorter training duration. Of course, you might think, why opt for family medicine or GP training when you have specialties like surgery or like radiology, you know, or like oncology, you know. At first, before I went into medicine, I wanted to go on to surgery. My aim of doing medicine was going to become a surgeon. I wanted to become a surgeon. I wanted to specialize in plastics or gastrointestinal or cardiovascular surgery. However, with time, as time progressed, and as I locumed as a pharmacist during medical school, I started to realize that I like the flexibility of the GP lifestyle. I also think that for me surgery is quite a long road, and although you are super specialized in one area, in my opinion, my honest and general opinion, being a generalist rather than a specialist seems to be a better way of helping our patients. Now, going on to how my life started out in medical school was, I started basically as a pharmacist back in 2012 when I graduated with my MPharm from Malta. I worked for around 2 years, and from there, whilst working, I liked the interaction with the patients. I felt that I could do more and not just dispense drugs as a pharmacist. However, don't get me wrong, I'm not saying anything bad against pharmacists. I think they do a great job, okay? I think that their efforts right now in the coronavirus pandemic are excellent, and without pharmacists we cannot function. I am a pharmacist myself, and of course I do feel that sometimes I miss the pharmacy related work. So why did I decide to go into medicine? Was the fact that I was always interested in doing a more clinical job basically, and when I had the experience in pharmacy school of working in the ENT section, in the ear, nose and throat surgery section, I found it very interesting. The work that the doctors did I found extremely interesting, and deep in my heart I said, why can't I do that myself, you know? That looks really cool, you know, I'd like to do it myself. So I decided that after 2 years working as a pharmacist, I should transition into medical school, and try it out. At the end of the day, I always am a pharmacist, okay? And if this doesn't work out, I can always go back to working as a pharmacist. What I found different compared to pharmacy when it came to medicine is medicine tends to be more based on the physiological aspect, on the patient's health as a whole, whilst pharmacy we do of course study the patient's health as a whole. However, we tend to focus more on the pharmaceutical aspect of health. I found medicine to be challenging mostly when it came to clinical diagnosis and differential diagnosis, because I think my training as a pharmacist, although it helped me come to the treatment side of things, when it came to the diagnosis, I think that it requires quite a bit of thinking. And most of the times, it's not a decision that can be done alone, but it's a decision that is taken as a team. So that part of medicine I felt quite challenging and quite different compared to pharmacy, but at the same time, I think that it's also the thing that drives me forward towards pursuing this degree. Now, throughout the course of medicine, did I find any hardships? Did I find any struggles? Of course, with any other course, yes, I felt that I struggled sometimes. The load sometimes was, I felt it to be too excessive. I felt like there was a lot of studying to do, a lot more than pharmacy. The topics covered, of course, are similar to pharmacy, however they delve into something totally different. But I also found that my knowledge in pharmacy helped me to understand the subjects more, alright? Compared to starting off fresh or anew, for example, I remember back in pharmacy reading about the physiology or the anatomy, where I had to study it approximately, I think, 3 or 4 times to memorize it. When it came to medicine, I felt it was slightly easier for me to pick up the stuff easier. What do I think about my future? Well, at this point in time, with the pandemic and all, and having worked during the COVID pandemic, my current ideas are either continue as an FY, of course, as a FY1 or FY2 in Malta, and after getting my license, I then will try and move to the UK, or try my luck in other places, maybe, I don't know, New Zealand, Australia, which also sound very interesting, United States, which also sounds really really cool, you know. There's loads of things. I think medicine opens quite a lot of options, so I think one must sit down and decide at that point in time, you know. For example, if people had to ask me, would you be doing medicine right now after pharmacy, back in the day when I was like 19 or 20 years old, I'd laugh at the person and say, you know, medicine after pharmacy, no way, I'm just gonna go work, you know, as a pharmacist, and that's it, you know, that's the rest of my life, you know. However, things in life change, and as we get older or we get in a different point in our lives, we also tend to evaluate our situation differently. And I think that is life, how life evolves over time, you know. At one point in time you might be thinking of becoming a pilot, but at another point in time you might reevaluate your life and say, you know what, I'd rather be doing this job because this job offers me better flexibility. So I think overall my decision from going from a pharmacist to becoming a doctor, alright, wasn't an easy decision at all. It was a decision where I had to sit down and contemplate and literally write down on a piece of paper the positives and the negatives of my action, the financial implications, because financially you're looking at 5 years in Malta, I mean, of no income or part-time income. At least I could locum part-time, you know, I could work part-time as a pharmacist, so that was a good amount of help for me. However, you also have to consider the overall situations in your country as well. You know, I mean, where you're going to live, how you're going to cope financially, how you're going to set your time between work, studying, and going to university. You know, so these things, of course, tend to play a role when it comes to signing up for the course. I mean, medicine is challenging. It's not an easy degree. And personally, at my stage, I think I also myself have doubts on my future career or whether I will specialize, you know. What would I do if I don't specialize in medicine? I've been thinking about this lately quite a lot. Of course, you also have to look at the alternatives. So if things don't work out, you have a backup, you know. Having traveled a lot during medical school, I think my alternative would be possibly maybe find a job, maybe as a medical writer, travel, or maybe even teach English in Asia, you know. I've been to Japan twice, you know. I find Japan quite interesting as a culture, food, transportation, technology. I mean, Japan is a top level country, you know. And if I ever decide to change my mind, I'll just hopefully, you know, go live in Japan, Tokyo, you know. That's my dream, you know. I mean, that would be amazing. However, at this point in time, I have to take things step by step, in baby steps. And at this point in time, I would think that my best option would be continuing into the foundation program or the foundation program UK, you know, and moving on from there, you know. So that's it for today, for our small introductory video. I hope you enjoyed the topic and I gave you some insights about my transition from pharmacy to medicine and how I feel about the current situation and my transition itself. Hopefully I'll carry out doing more videos in the future based on more productivity videos, maybe more travel videos. I would also like to make some more videos on Japanese language, alright? Okay, again, see you guys. Thank you very much for again, and see you next time.